Tell us about your biomedical science career.
My name is Jeyrroy Gabriel, and I currently work as a senior biomedical scientist at St. John's Dermatopathology Lab, which is part of the Viapath Analytics Labs based at St. Thomas's Hospital. So I joined St. John's back in 2014. And St. John's is a specialist histology lab that deals predominantly with cutaneous disorders such as you have autoimmune diseases such as lupus and eczema, and cutaneous malignancies such as melanoma, lymphoma. So my career at St. John's, I first entered the lab as a very junior level as a medical laboratory assistant after graduating with a degree in biomedical science. And from then, I've been grateful to have had the opportunity to complete a variety of different academic projects, such as the Institute of Biomedical Science Certificate of Competence, the Specialist Portfolio, as well as my MSc in Biomedical Science as well. And this has led to me progressing through the various roles at St. John's to my current role as a senior biomedical scientist.
What makes your work in histology unique?
So that's a good question. So in terms of histology, something that's a bit more unique about histology is that it's a very hands-on manual discipline compared to other specialties which are more automated. So aspects of histology, for example, the dissection of biopsies or the embedding of the tissue in paraffin wax, which is commonly used in histology, and the sectioning of the tissue onto slides, and even certain staining processes are all quite manual. So if you're a very hands-on person, which I tend to be, it's the perfect discipline for you. So I think that sort of sets it apart from all the other sort of fields. As well as that, it's a very visual discipline as well. So the end result, the slide, can be stained in a variety of different stains and the tests, which sort of paints a beautiful picture. You can see how the normal gets altered into the abnormal. So you kind of, as a visual and a manual hands-on person, that is why I really love histology as a discipline.
Why don't more people pursue biomedical science careers?
So I think, so every year, I think there's thousands of, undergraduate biomedical science students graduating each year. But the problem is majority of these degrees aren't sort of incorporated with completion of the IBMS certificate of competence. And what this means is you're able to graduate as a biomedical scientist, but you can't work as a biomedical scientist because you can't get that HCPC, the Healthcare Professions Council registration. And this puts a big barrier on a lot of students because they're very eager and keen to work as a biomedical scientist, and as a result they have to compete for the very limited number of trainee spots and entry-level position, which is quite sad to an extent. But I think the solution to these sorts of problems is if more sort of workplaces offer these sort of training roles and more sort of apprenticeship schemes. So from my personal experience in our lab, we have a lot of opportunities for trainees. So everyone is encouraged to sort of pursue their portfolio. So we have 3 going at the moment for their training portfolio, as well as one, the Viapath offers like a apprenticeship scheme for non-science students to become biomedical scientists as well, through a partnership with Staffordshire University. So things like that will definitely sort of allow more students to embark on this journey to become a biomedical scientist, which is important, I think.
What's your favorite part of your work?
So I would say, obviously the routine work is quite rewarding in terms of you're processing a patient sample, but at the end of the day, this can impact the diagnosis and treatment for this patient. But another aspect which is very much encouraged in sort of my workplace is to get involved in research and innovation. So in our lab at St. John's, actually my manager, Dr. Guy Orchard, and a very big histopathology product producer have developed so innovative products such as CellSoft and Truce, which is like a solution for keratotic tissue, and things like true slice dissection devices, which are all sort of it ensures that we continually progress and improve our field. As well as that, I've had the opportunity to get involved in some other research projects as well, all of which I think allows me to sort of become more it helps staff to sort of problem solve, to sort of improve the organizational skills and teamwork skills, which are all vital in a routine diagnostic setting. But on top of that, you ensure you're continuously improving your tests, the accuracy and the turnaround times of your tests to ensure that, and at the end of the day, we're working to ensure that the patient gets the most accurate and quick result as they can. So that's something I enjoy that we do a lot, is the research and innovation aspect.
And your least favorite?
That's a tough one. I would say, I mean, the last 2 years has been challenging for everyone in terms of the pandemic, where and we've definitely seen an uptick in workload. But I think this has been really beneficial for in a certain way as well. That it's definitely brought the team closer together. So there's sort of more teamwork and more so communication between all of us, which has made sort of dealing with sometimes when the workload is a bit higher a lot easier, and you get support from your management as well to ensure that the workload can be managed. And I find that we've actually grown stronger as a team as a result of that. So, yeah.
What's the most interesting thing you've experienced in your career?
I would say something that is very interesting and fascinating to me that we do at St. John's is the Mohs micrographic surgery procedure, which we are one of the largest centers in the United Kingdom. So the Mohs micrographic surgical procedure is in fact an intraoperative technique, which is used to treat a variety of different skin cancers, such as basal cell carcinoma and squamous cell carcinoma. So this procedure involves the Mohs surgeon removing a small margin of tissue around where the tumor is. And this sample is then sent to the lab. As the patient waits, we'll process the sample in the lab. So in the lab, the sample undergoes what's called as frozen sectioning, where the sample is cut in very cold temperature into very thin slices, and then put onto a slide for staining. And we stain it with two common dyes used in histopathology, which is the hematoxin and eosin stain. So once these are stained, these are then evaluated by the Mohs surgeon / consultant dermatopathologist, who will then determine if there's tumor cells still present, in which case they would go back and take a bit more tissue from that area, or if not, they will close the hole that is left, or the defect they call it, for closure. So, but the thing that fascinates me a lot about this procedure is, so a lot of the times, these patients, these tumors, while it does not cause a sort of high rate of mortality, it has a really destructive effect on the local tissue architecture. So, for example, if a patient may have a tumor on the nose, let's say, they may find that large portion of skin and tissue may have to be removed, which will leave a big hole in that patient's nasal sidewall, let's say. So the thing that fascinates me is how the surgeons actually end up closing it. So sometimes they would do what's called a forward flap. So they take a little bit of thin strip of tissue from the forehead, bring it down onto where the area where the defect is, and over time they will sort of allow it to graft and grow into the area. And in a couple of months' time, when you see the patient again, it's as if nothing ever happened, and it's like, you know, it's almost like it's back to how it was. So it's really always fascinates me how they do the reconstruction, and it's something that's always I enjoy looking at and seeing how good the results are.
What one key thing would you like to share about what you do?
So I would say that no matter what discipline, so whether it's histology or, you know, any of the other lab disciplines that you want to pursue, at the end of the day, we're all working for one common goal, which is to be able to process a sample for the patient and provide a diagnosis or a test result at the end of the day. So if you're someone who's early in your lab career path, the one thing I would encourage everyone to do is to try and work out, so what field interests you the most. So this can be either at university when you start studying the different modules. There may be one field that you find more interesting or more appealing to you. I would then probably encourage you to pursue that either through work experience or even through your university, and gain some exposure in that field. So that way, at least you'll be able to see which fields you're enjoying and you would like to pursue further. Because at the end of the day, you may find that this is the career path you'll enter for the rest of your career. So once you find that field that sort of piques your interest and sort of suits your skill set. Like, for example, histology for me, I mentioned I'm a very hands-on person, so this one worked out quite nicely for me. So if you find that sort of discipline for you, I would highly encourage you to pursue it. That's my one word advice I would give.